Good evening and welcome, colleagues. Just giving a minute or so for people to join, but I think I'll kick off. My name is Maurice Goodman, and as the Chief Medical Officer of Discovery Health, it's my profound privilege and pleasure to welcome you to tonight's webinar. The webinar is focused on providing you with an update on the Protection of Personal Information Act, affectionately known as POPIA. We will also demonstrate to you the secure communication process that we're implementing to ensure compliance with POPIA. So tonight is the third session in the series we've facilitated to support you as healthcare professionals as we near the end of the 12-month grace period. We're delighted that there's such a significant interest in this topic, and indeed there were over 1,200 colleagues who in fact registered on tonight's webinar. We've also shared some supporting POPIA communication and podcasts with you over the past few weeks, and our presenters tonight will provide a brief recap of the previously shared 10-point checklist to ensure practice readiness, as well as address some of the key themes based on the questions that we received in the previous POPIA webinars. A recording of the first webinar is available to you for further reference in the webinar section of our COVID-19 hub for healthcare professionals. So just briefly, a bit of a framework for tonight's session and also some house rules. We'll start with a 25-minute presentation, followed with about 15 minutes focusing on how we'll be communicating with you. We'll then take questions, and out of respect for your busy schedules, particularly during this difficult period, we will adhere to time and conclude by 8:30 at the latest. Please do post your questions in the Q&A section, and we've noted from past webinars that questions typically do come in high volumes, and so we'll do our very best to get through as many as possible. When necessary, we'll curate the questions and respond to them thematically rather than on a question-by-question basis. And then please note at the end of the session, we do have a short poll that will pop up on your screen. Please do respond to this, as it helps us to ensure that we continue to improve on these sessions going forward. So without further ado then, I'd just like to introduce the topic for tonight, which is POPIA for healthcare professionals and preparing you for secure communication. The webinar will be led by Larry Borowitz and Diana Davids, and just a brief introduction to both of them. Larry's tertiary academic training is information systems, and he is a certified Lean Six Sigma Master Black Belt. So none of us mess around with Larry. He's been employed by Discovery Health since 2003, and is currently head of our Services Lab Operations Management. That's a department that's responsible for governance programs and enabling process and service optimization through measuring and monitoring key service metrics. Larry's the Deputy Information Officer for Discovery Health and has been responsible for, inter alia, the company's quality management system, as well as our Treating Customers Fairly program. Diana David, she heads up a team responsible for rolling out Discovery's key strategic initiatives, including those within the healthcare professional space. She's been with Discovery for the past 6 years. Diana has degrees in health sciences and public health, and over 10 years experience working in the health funding industry. So I think you're in very good hands. And without further ado, I'll hand you over to Larry.
Thank you, Maurice, and good evening, ladies and gentlemen. As you can see from the slide in front of you, it says, let's recap our readiness journey. So for those of you who attended one of the first webinars which we presented, you will recall that we put together a 10-point checklist to look at ways to get ready for the 1st of July, which is hard to believe going to be in 2 days' time. So what we thought we'd do is just recap the 10 points which we listed, and then go into some more detail in terms of some of the questions which were posed and provide some of the answers to you. So to kick off the first point on the checklist, it's around information officer identification and appointment. So you will recall that every organization, whether it be a public or private body, needs to appoint an information officer. And by default, the head of a practice would be the information officer, but that person can appoint someone else in his or her stead to play that role. What can also transpire is that the information officer can say that in terms of the size of the practice, they'd like to appoint deputy information officers. And those people are responsible for supporting the information officer in his or her duties. I'm going to go into a bit more information about what's transpired around information officer appointment. But the key thing is that over the past number of weeks, it was important to consider who your information officer was going to be if it wasn't going to be the head of your practice, and whether or not you wanted to appoint what we call DIOs as well. So if you have not done that yet, then what we suggest is that you start urgently considering who your information officer and DIOs will be, and you start preparing those names in terms of registering them. The second item on the checklist is the question around access to information. So what we were saying then, which is obviously applicable more so from the 1st of July, is that physical access to patient files or physical assets must be secured and only accessed by designated staff. So if you've got your Manila patient files, when you put them out to be collected by yourselves as healthcare practitioners or as practice managers, when you put them out for the healthcare practitioners, you need to make sure that they're in a secure place and that only the healthcare practitioner can access those. In terms of storing information, one should do it in a locked cabinet or in a locked cupboard, so that when in a period when those files should not be accessed, no one can access them. The other element is around computer systems and making sure you have security controls in place for those systems so that they can only be accessed by authorized individuals. So this would be things like passwords, looking at your email access, and making sure you've got all the right elements in terms of things like cybersecurity in place, and that you've checked those so that the ability of someone to compromise or hack into your system is minimized. The third point is around what we call privacy statements. And each practice is required to have a privacy statement, which should include POPIA-related clauses. What we're proposing around the privacy statement, and we've created one, a template, which we have shared with a number of you over the last number of weeks. And if anybody still wants access to it, it is available. You can contact your account manager to obtain this. But in essence, a privacy statement is the key document which describes how you and your patients have their information protected. So in that privacy statement, you'd state what your rights are and also what the rights of your patients are in terms of how you protect their privacy. What we're suggesting as well is that rather than getting people to re-sign their registration forms, that you share your privacy statement with your existing patients, and you can either do that via email or digitally, or even by placing it in your practice as a document which can be read, for example, on the walls, depending how long it is. But it is important that your patients understand what their rights to privacy is in terms of your practice and what your rights are in terms of how you plan on protecting their privacy. In terms of patient registration forms, what we've suggested here is that you update your registration forms to include the relevant clauses relating to privacy. And this would also include the question around consent. The key thing about the patient registration forms now is that when you collect information, you should only be collecting the minimum amount of information required to process your patient information. So again, to share that example we shared last time, if you on your patient registration form have a question around someone's income, that would not be in terms of the minimality principle or obtaining minimum amount of information, complying with the Act, because you'd be asking for information which should not be relevant for the purpose which your patient has appointed you in terms of the service they want you to provide to them. So what you need to do is look at your patient registration forms and make sure they have those clauses. And then from now on, when you have people coming into your practice to join your practice, they will then sign that form and grant the necessary consent in terms of what information they're prepared to share with you and other practitioners. In terms of information quality, with POPIA, what the Act is trying to promote is that people keep their information up to date. So this is a good time to say to your patients that we'd like you to please make sure you provided us with your most recent information, update any biographical and contact details, and if that is provided, then this is the onus on the practice to capture that information in your systems. So it's really trying to get everybody to start being conscious of what information they've shared with their practices. In your case, is it up to date, and making sure that they keep it up to date so that in the event of a problem, that is easy to contact, for example, the next of kin. In terms of retention policies, every practice needs to have a policy in place where you've decided how long you want to keep information for. After a certain period of time, and in most practices cases, it could be about 6 years, you're required to delete that information or de-identify the information that you have on record. And this information is not only information on your computer systems, but also, for example, old files. So those files, for example, then would have to be removed from your cabinets, and then the information would have to then be removed, deleted, or de-identified in some way, which could be done through shredding. In terms of accessibility, you need to make sure that all the information you have around your patients is accessible, because patients do have the right to ask for information that you have about them on record, and they may ask you to share that information with them. So this is through the POPIA Act, which we mentioned last time, which stands for the Promotion of Access to Information Act, where what the Act does, it really allows someone to say, I want to know what information you have about me, and I'd like you to tell me what that information is. So you are then obliged to share that information with your patients, and therefore you need to make sure that if someone does ask, it's easy for you to access that information, both physical as well as digital assets. In terms of third-party contracts, there's now a lot of activity happening, certainly across, I think, most of the country, where people are looking at their operators that they're using to process their data. And what one needs to do now is make sure that all the contracts you have in place with third parties who process information on your behalf, like bureaus, like labs, etc., have got contracts with you in place where you, as a responsible party, are confident that they are going to manage the data you've shared with them to the best of their ability, and as you'd like them to do as per the POPIA Act. So if you've not gone through your contracts, what you should do now is really look at all your contracts, consider what clauses are included in those. If there aren't any relating to privacy, one should then add clauses to those. There have been questions asked around, like, who do you speak to around your third-party contracts? And you probably will need a legal practitioner to assist with some of those, depending on the complexity of those contracts. In terms of external communication, you need to have a policy, and then you need to put procedures in place in terms of how you communicate externally from your practice. And this would typically be around using suitable technology to enable yourself to communicate externally. So the example of this would be your email system that you have and how you are protecting information which you are sending externally. And one way of doing this would be encrypting your documents, that when they do go to an external party, they are encrypted with a password, so the other party receiving them would then have to open them using a password. Last but not least is the question around training. And this is very important to make sure that your staff are cognizant of POPIA, or are aware of what the Act entails, and that you cover certainly some of the basics. And that would be things like not sharing passwords and keeping desks tidy as well. So if you would have followed these 10 points, and hopefully many of you have, we're hoping that you're feeling ready for the 1st of July and for the full enactment of POPIA. In terms of answering some of your questions, what we thought we'd do is just go through 5 key concepts which were raised in the last few webinars. So the first is around the information regulator. So as you can see on your screen there, we've put the URL of the information regulator's website, because people have been asking us, where do I get information about the regulator, and you can get it on that URL. I think something very important in terms of the appointment of information officers is that the information regulator has been having problems with their technology, with their website. And as a result of that, they've not been able to register information officers on the website. So what they've done, they've said, per the notice they published, that from the 1st of July, if an organization, whether it be a public or private body, has not formally registered the information officers, they will not be subject to any kind of sanction by the regulator. So from that perspective, one has more time to actually capture your information officers and deputy information officers' information on the regulator's website. They're not given a date when it has to be done by. So what we can suggest is that you just monitor the website, go in a few days' time, try and register yourselves, and then see if the website is up and you're able to do that. Another key point which transpired over the last number of weeks was that in some cases, you may want to appoint the same person to be the information officer for more than one legal entity. So what was happening is that if, for example, I was registered on practice 1, and then I was going to be registered on practice 2 as the information officer, the website would say you cannot be the information officer for more than one organization. That was causing quite a lot of angst in the general community, and the information regulator then really looked at that issue, and they've decided now that one is able to be an information officer for more than one public or private body. So if anybody listening to the webinar tonight is considering being the information officer for more than one practice, that is the good news is that now that is possible. So when you go register, once the information officer opens up their website, then you should be able to register as an information officer on more than one site. Something else I wanted to cover, which we've seen quite a bit of, is people are saying, can you get a certificate? Can you be formally certified as being POPIA compliant? So something I want to stress is that there's no such a thing as being certified or getting a certificate from anybody. So if you get a lawyer or you get someone who comes and says to you, I can sell you POPIA in a box, and if you follow this box, you'll see at the end of the, or included in the box is a certificate. All you need to do is just complete it and send it back to me and I will sign it. I can tell you now that that paper is not worth the ink that's been written on it. So what it means in terms of being POPIA compliant is that you yourselves need to understand what you've done in terms of regulations, follow the regulations to the best of your ability. And if you wanted to determine if you were complying with the law, you could get a legal firm to come in to just kind of understand what you've done, and you could take them through that and they can give you an opinion. Or potentially, if the regulator decides to come audit you, then you will certainly know how compliant you are, because they will obviously say, what have you got in place? What have you done? And they will then ascertain if you've complied with the Act. So as I say, if anybody tries to sell you a POPIA in a box or any kind of certification, you can tell them that, you know, that that's not valid and that they should ask for ways to make money by doing something else. In terms of the question of patient consent, so I think the first thing to do, and I sort of mentioned this a bit earlier on, is that you need to make sure that your patients understand what they're consenting to. So when they're signing your patient registration forms in terms of going forward, or you've communicated to them your privacy statement, in the privacy statement, there should be clauses relating to the patients giving you consent in terms of you being able to share that information with other parties, and the fact that they're happy to share that information with you. And the fact that the medical fraternity deals with what we call special personal information, or SPI, it's very important that you get the right type of consent from your patients. If you haven't updated your registration forms, again, make sure that you've updated those. And something else which is also important is that often practitioners need to refer patients in terms of information to other practitioners. So you may want to get a second opinion, you may have to refer as a GP someone to a specialist, and it's very important that you've got consent from your patients to be able to do that. So make sure that your clauses do include the ability to share information with additional practitioners to provide medical care and other services to them. Patients can only sign their own consent when they're 18 or older. We did get a question previously in terms of someone younger than 18, and that's not applicable. So in terms of granting consent, a person must be a South African adult, which would be from the age of 18. And then another question we got is that if, for example, there's an emergency and you cannot get a signature from a patient, what we're saying is then you need to have evidence to show that you attempted to get consent from the patient. So it could be via email, it could be through some kind of other format like an SMS or trying to get a message to the patient to say, I need consent in order to do this. Please, can you provide it as soon as possible? If you can prove that you've attempted to get that consent, first prize is to get the signature. Second prize is to obviously get a response from their patient. But if there are emergency circumstances, then as long as you show that you've attempted to get patient consent, you should be fine in terms of complying with the Act. And then depending on what you had to do in terms of that consent, hopefully there should be no issues thereafter. In terms of virtual consults and notes, there have been some questions around, if you have a virtual consult, what can you do around recording the conversation? So what we're proposing is that if, for example, you're using Zoom or Teams, that you personally ask the patient if you've got their permission to record the consultation. So if you do that again, then you've got the permission and you should be able to record that and then keep that thereafter. In terms of your patient notes, you need to consider what processes you have in place to protect those notes. How do you keep them in your files? How do you make sure the files are secured? And just make sure that all the notes that you are taking are being kept away from, let's call it prying eyes. In other words, if there's anybody else who comes into your room when you're consulting, those notes should be kept only for yourself and for the patient you're seeing and not for anybody else coming to the practice. If, for example, it is a nurse or someone like that, then obviously you can share information with them. But the main thing is you just need to consider that you keep the notes about your patients confidential. In terms of sharing of patient data, and a lot of this has got to do with when you submit a claim to Discovery, you as a doctor will be sharing your patient information through the claim that you've submitted to Discovery. So in terms of having those third-party contracts with providers like your B2B providers or your PMAs, that should protect you in terms of saying you as a responsible party are sharing information then with the a PMA or B2B practitioner who's then passing it on to Discovery as a recipient of the data. So the contract you need to have is with your operator, who in this case is going to be your B2B provider or PMA. What's quite important maybe to stress is that Discovery is receiving information from you on behalf of your patient. Okay, so that's why what we're saying, you don't need to have an operator contract with Discovery. You can send Discovery your claims through your B2B provider or PMA, or your patients can submit their claims on their own through using, for example, the Discovery app, or some other way of getting it via email to Discovery. But as a practitioner, if you are sending information to Discovery, I'm not sure how many people are sending documents via email, okay, but you are then sharing that information on behalf of your patients, and you can then decide how you want to protect that information when you send it on to Discovery. But I think I want to just stress the point, we don't need to go into a contractual relationship in terms of a responsible party operator relationship, because we are receiving information from our patients or your patients and our members who've signed contracts with us in terms of protecting their information. In terms of sharing information with locums or other doctors, or even if you sell your practice, in your privacy statement, you should have clauses which enable you to then share that information. So again, it just highlights the importance of the privacy statement. You are able to share information with anybody who assists you or takes over your patients in terms of treating them. So I think you need to be concerned as long as your privacy statement gives you that right and the patient's giving you that consent to share that information. We've also had a question in terms of, does POPIA apply to deceased individuals? And the answer is no. POPIA only applies to living individuals or juristic people, in inverted commas, like companies, trusts, or closed corporations. Then in terms of sharing information on public platforms like WhatsApp. So the view we've taken in Discovery is that WhatsApp is a public platform and you cannot protect information when you're using it in terms of it's open and it's only as secure as Facebook has made it that runs WhatsApp. So there is another product out there we thought we'd just advise you. It's called Synapse. What it enables one to do is create a kind of closed community where yourselves as practitioners and other practitioners as well as family members can join a particular secure group, and then you can then communicate as and when required if, for example, you've got quite a complicated case that needs communication with family members as well as other practitioners. So there are other tools out there. Again, if, for example, you want to use WhatsApp and you say that's a tool you've chosen to use, then you'll just need to make sure that you've got the right consent from your patients that you can use that as a channel of communication. In terms of consent for emergencies, Section 32 of the Act does deal with the whole question of authorization of data subjects' health and sex life. But what it does say is that the Act would not apply, for example, in terms of consent and normal process to follow if there was an emergency situation. So if someone comes into an emergency room and they're unconscious and you need to treat them, it's obviously not possible at that point to get consent from them. And that's why what's most important is that you treat them and try to get them well, rather than worry about getting consent at that particular time. Obviously, if there's family members who've come with that person, then it's a whole discussion around that person signing consent on behalf of the patient. One other question we got was around sharing data in a ward. So if you've got a hospital ward and you've got x-rays being received from the radiologists for the different patients, and the computer monitor sort of faces outwards and people can see the different x-rays of the different patients. The issue here is that you're sharing information with other practitioners who are not treating that patient. So what you should ideally be doing is making sure that if, for example, there's yourself and another doctor who's seen that patient, that only yourselves see that information, which would be, in this case, x-rays relating to that patient. So I'm not sure how the software would work in terms of a practice or in terms of the hospital, but what would be important is that only doctors who've been appointed to care for that patient would then have access to information relating to that patient, whether it be files, whether it be x-rays, etc. And then in terms of disposal of patient data, we've got a question around use of Gmails. And the reason why I bring it up under disposal of patient data is because we want to make the point that Gmail as a mail account in terms of something at gmail.com is not a problem in terms of POPIA. Okay, in terms of if you say, I send a mail to gmail@gmail.com. The issue we have in terms of gmail.com accounts is more in terms of what happens when someone in your practice has a Gmail account in which they are storing personal information or special personal information about your patients. And what can transpire here is that if someone leaves your practice, the Gmail account actually belongs to, again, Google. And that person, for you to ask them to please remove the data becomes quite difficult because they say, but I created the Gmail account in my own name. Yes, we agree we have it as a practice account, but there could be an issue in terms of downstream when you want to ask the person to delete data. And of course, they're keeping a lot of PI and SPI on a Gmail account. So what we're proposing, if you haven't done this yet, is that ideally you create your own domain name for your practice. That would be like a practicex@.co.za, for example, and that would be managed by your own practice IT staff and yourselves, so that if someone leaves the practice, you can close down that account and you can move the information that's in that account very easily into someone else's account or someone else's email account in your practice. So I think that's a very important point to say, like, what you just need to consider what domains people are using for your practice and finding a way to secure information in a better way than using Gmail accounts or public accounts, and rather make a private domain which you've got more control over. Then in terms of a period to dispose of data, so what we've seen from the HPCSA, what they're recommending is that you keep information for 6 years from the time a patient leaves your practice as a patient. If, for example, you're a gynecologist or an obstetrician, what they're suggesting is to keep information up to the time that a child that you delivered would be 21. And then for mental health practices, the suggestion there is that you keep information indefinitely. If your computer or your cell phone is lost or stolen, and on that you have got PI or SPI, what we're proposing as a first step is that you've got a password on your technology, whether it be a laptop, computers in your office, or your cell phone. So the first thing is that if something has to happen, at least you can say that in terms of the case that you may have to open from a POPIA perspective, I have got protection on my phone, and the ability of someone to access information is limited because there is some kind of barrier, i.e. your password. You would have to, though, depending on how much information is stored on that, and if you can say, yes, I definitely have got PI or SPI on my technology device, you then have to notify your patients and the regulator that there was an issue in your practice, that information was stolen, it has got a password, it has been protected, but you do want to just confirm to your patients that there has been an incident and that you'd like them to know that you've done everything in your power to protect information, but there was theft of a device or devices in your practice. And then in terms of, as I said earlier on, in terms of physical assets or physical documents, those need to be disposed of through shredding. You can't just throw them in the bin in terms of them being whole pieces of paper. You need to make sure that nobody's able to determine what was on them. And the best way of doing that would then be by shredding. So hopefully that sort of covered quite a few of the questions you may have had when you attended the last webinar, and I see the additional questions coming in, which I look forward to addressing later on. Thank you very much. I'm now going to hand over to Diana.
Thank you, Larry, and thank you to everyone for joining. So I'm going to be taking you through some of the practicalities in terms of how we will be communicating with each other. So in order to comply with the POPIA requirements, any communication that comes from us, from Discovery Health, that contains any personal information related to you, your practice, or your patients, can only be shared through some kind of secure communication channel. And so to solution for this, we have two secure communication channels. The first is the secure inbox. So the secure inbox can be accessed on the health professional zone, which is on our website. And all communication that goes to a health professional or the practice will be sent to the secure inbox. When a communication item is delivered to the box, you will receive an email notification highlighting this. Over the next few weeks, we are going to be migrating all communication to the secure inbox. Obviously, during this transition period, you'll also be receiving communication as you normally would. So don't be alarmed if you go into your secure box tomorrow and you can't find any communication. It is a transition over the next couple of weeks. Then the second communication channel would be through email encryption. So if we have an attachment in an email message to a healthcare professional, it will be encrypted. You will then be required to decrypt it using your ID number if we have it registered on our system. If we don't have an ID number registered on our system, the date of birth will work. And then you'll get the communication into your secure inbox. Important to note that no encrypted emails will be sent to the practice. It's just for the health professional. And then on the right-hand side of the screen, you will see that this is an example of an email communication that you'll receive if there's communication in your secure inbox with directions on how to access the information. And then as we've mentioned before, we've been sending a series of communication to you over the last few weeks, really just highlighting a POPIA and what it means to comply, and also how we will be communicating with you. So through the secure inbox, there's also steps in the communication in terms of how to access our health professional zone, steps on how to register, and then how to find your secure inbox. But I'll take you through a demo just to help you navigate. Before that, this slide just shows you the type of communication that you will receive and then the delivery mechanism. So as an example, you'll see your benefit confirmation or your enrollment letters, and these are things like disease management programs, CIB, home care, etc. These will go through to your secure inbox. Claim statements and remittance advice. Currently, you'll know that it is available on the HB zone, but once our system change goes live, they'll be sent to the secure inbox as well. The year-end benefit and tariff information, communication pieces, there's no change to this process. An email will be sent to you notifying you that that information is available on the HB zone. Similarly, your practice profiles will also be available on the HB zone. Confirmation emails for health ID consent. These will also go to your secure inbox. So very quickly, we will show you a video which will demonstrate the secure inbox, how to access it and how to navigate.
What is the secure inbox? Think of the secure inbox as a repository where you can access all documents in their unencrypted formats that only you should be able to view. In order to display these documents Discovery has sent you, you will be required to log on to the Discovery website. If you're a provider and a member, please ensure that you select to enter the correct zone when trying to view communications sent to you in your provider context. There are two ways in which you can access the inbox. The first being from the menu item, select Communication, Personalized Practice Communications. The second way to access the secure inbox will be from the email that would have been sent to your standard email exchange account from Discovery. We have provided you with a hyperlink that, should you select it, you will be taken directly to the secure inbox. There are four main pieces of functionality on this screen. The first being the act on behalf of. As a representative of a practice or a provider, you will have access to view communications that have been sent to you in your provider representative capacity, as well as to the practice or provider that you are allowed to act on behalf of. The next piece of functionality is the search bar. By keying in any words in the search bar, you have the ability to find a specific communication that matches the key phrase. You may also key in the reference number that was sent to you in the email from Discovery. The filter option, we allow you to filter by date range. This will then allow you to narrow down the communications that are displayed on the default landing page. Once you've captured the date range filter, you will select to apply filters. When you are done, you will then be able to select Clear All Filters to return the view of the standard landing page. The final piece of functionality is the communication line item itself. This line item will allow you to view the detail of the communication sent. By selecting to view the communication attachments, you will no longer need to key in a password. You will simply need to open it up. The communication also will show you when this communication was sent and whether it was delivered successfully. By expanding the communication line item, you are in effect marking it as read. The inbox is still in an infant stage and has so many more features that will still need to come. We look forward to enhancing our inbox as we go on this POPIA journey with you. Thank you.
Thanks. So now that you've seen how to access the secure inbox and how we will be communicating with you, perhaps we can touch on how you will be interacting with us. So what can you expect when you interact with us? So from a calling perspective, all individuals that interact with us telephonically will need to be registered on our system. So we are applying an additional verification step for calls. So effective 1 July, we'll be asking for additional information. So this is your full name, your surname, and your ID number. And then these details will be used going forward for verification purposes. Then queries that are sent to our email support channels. So the emails that you send to healthpartnerinfo@discovery.co.za, the sender's email address will be verified before any correspondence is released. And then additionally, we also have a security enhancement on our correspondence tool in July. So once this goes live, it means that all correspondence from us will also go to the secure inbox. And then queries emailed directly to other servicing channels. And an example of this would be account managers that are allocated to your practice. If a response to your particular query contains any personal information, then the email will also include a password protected attachment with that information. So now we know that this is a little bit of a change to the communication flow. And so we're creating a spot, a little place on our Discovery website that will have all the necessary POPI content for you and to help you to feel supported through this change. On this page, you'll find podcasts that have been released already. We're also going to be putting a navigation guide, which helps you navigate the HP zone, register on the HP zone, access the secure inbox, and then also relevant forms. So that includes linking individuals to your practice. There's a very comprehensive FAQ document, as well as the webinar recordings. I'm just going to show you where you can find this particular page. So if you log on to our website on www.discovery.co.za, you will see that you don't have to be logged in to access this information. You will scroll down on that landing page and click on Healthcare Professionals. You will then be directed to the logged out page of the HP zone, and you'll see Larry's face there on a banner. And then you'll scroll further down to access the POPI content on the right-hand side, and that's where all the information will be stored for you. So just maybe to summarize quickly, what I've presented to you was our two secure communication channels. So it was the secure inbox as well as the email encryption. We've also given you a view of the verification process that will be enhanced on both the caller and email perspective. And then we've also created and provided for you additional information on our logged out page, which gives you all the POPI content that you'll need to help you through this change. I hope you found this valuable, but if you have any questions about these specific processes, please feel free to pop it in the chat. Thank you. Morris, I think I can hand over to you now.
Good. Thanks, Larry and Diana. It's a lot of information to absorb, but I think you put it across well. So thank you for that. Just to respond to a few queries that came up, in terms of accessing the 10-point checklist and the privacy statement template, etc., the slides and videos. I think Larry did have a slide on that. But if you do need help that is on the HP zone, or you can ask your account managers to help you access that. So that should be readily available to you. Larry, Diana, I don't know if there's any points you want to go into before I kind of start responding to some of the themes that came through on the chat.
Yes, so Morris, I've been looking at some of the questions. I mean, I think there's a key theme here around sort of a sole practitioner versus a group practice or a large kind of practice. And people are asking, what do I do if I'm sort of a one-person practice with just myself and a receptionist, and you outsource your account? So I think the key point we're trying to make is that if you do the basics, like you sort of say you are the information officer and you register yourself, and you look at your privacy statement, which you created, and you update your registration forms. You kind of then look at how you're securing your physical files as well as your computer systems. I don't think you need to really spend a lot of money to do all that stuff. It's just a question of really following those 10 points which you put down and just making sure that you've considered them and that you've got you've taken cognizance of the things that you need to do. So I think it is very doable, even though you may be a small practice. But I wouldn't get hung up about the fact that there's so much to do and there's a myriad of hoops to jump through. There are some of the basics to do, and I think if you've done that and you've really given your patients some kind of assurance that you consider their privacy, I think that's really what's going to be required from that perspective.
Good, thanks, Larry. I think there was a question specifically about health professionals who have patients with them for a long time. Many years, certainly more than the kind of 6 years that you spoke about. So there's talk about
So Morris,
destroying
I think
6 years, etc.
the key point here is that when we say 6 years, it's from the time the patient has left the practice. So when someone is an active patient, the information can be kept for as long as that patient is active. It's only 6 years. So I saw that someone put there 37 years of treating a person. So, if that person leaves your practice, then only after 6 years would you then need to then remove that information from your records. So it's important to recognize that your active people can stay on your books indefinitely.
So that's 6 years after leaving, not 6 years after they first consulted with you.
Correct.
Couple of questions around, I think, messaging and storing information. So how to share claims via email that are password protected without, disclosing to us those passwords?
Yeah, so Morris, this is obviously quite a tricky one, because if you send information to Discovery and you encrypted it, we've got to find a way to decrypt it. So what we're thinking is that if you're going to send us a file and you want to encrypt it, that you use your billing practice number as the key to kind of unlock, or your password. And then once we get that information from your practice, we can then decrypt your document using your billing practice number. So that would kind of standardize how we do that. We acknowledge that the billing practice numbers, are available, but I think in terms of adding that layer of security, it just protects it far more than it would be if you just had to send it without any kind of protection. There's also, I think, another question around, if you send the document to Discovery and copy the patient, then you then encrypted one document. So you then need to either send the information separately and decide, okay, maybe for Discovery, you're going to send your billing practice number, and for your patient, you put their ID number in, or you give your patient your billing practice number, but you, as a practice, have to decide what you want to do in terms of the policy you're going to have around protecting the information in your communication. I think what is important is that if you're sharing information, what's important is to put any kind of personal or special person information inside an encrypted document, like a PDF, and that you minimize the amount of information you're sharing in the body of an email or in the subject line, so that you don't kind of disclose information inadvertently about a person, which is obviously easily readable if it's not protected. So that's what we're proposing in terms of sending information or claims information. I think something maybe to consider is that, your patients, if you have a cash practice or you give your patients your invoices, they can scan those and send them to Discovery using technology on the phones, on the apps. They can send them in. So in that case, they'd then be responsible for sending those. And the vast majority of our claims are electronic. So what we do find is that most practices today are sending claims through B2B providers or PMAs. So because you've got those relationships, and most people should have the operator responsible party contracts in place, there should be very little to be worried about in terms of protecting that, because it's coming through a secure channel through an operator license to Discovery. So, the vast majority of practices using electronic submission of claims should be protected.
Thanks, Larry. Moving perhaps to a more interactive situation. Many of the health professionals work in hospitals, and how can they collect data from hospital records, like admission files, etc.? How does the consent work in that situation?
So again, it would be important in terms of what the consent forms that the hospital has created contain, because if the hospital forms say that as a patient in the hospital, they have the right to share information with treating practitioners, then by rights, the practitioners can then obtain that information about the patient when they're in hospital. So I'm not sure, again, what the hospital privacy statements look like and what they say they can share or cannot share, but I certainly think that the ability to obtain information of a patient that's been admitted to hospital that one is treating, you would have rights to access that information and obviously keep it based on what transpired during that stay of that patient in the hospital.
Thanks, Darren. Then a couple of related questions around kind of interacting with us. So, for example, on a PMB application that contains personal information, how do they, any challenges in terms of emailing or getting that to us? Also, calls and verifications that apply to confirming benefits, chronic benefits, hospital lengths of stays, etc. That kind of interaction with us.
Yeah, so again, like it's the more we can use digital channels, the more preferable it is, because you don't need to use passwords. So if, for example, someone's using Health ID for an application for a member for chronic cover, then that would then be secured. It's always the paper forms, which are then sort of scanned and then made into digital documents, which cause the complication. So what we are saying again there is that we will send out information to you with your billing practice number to decrypt those. And then if you send that to us, you're welcome then to go to use that billing practice number. The secure inbox is really our long-term solution to reduce any need for passwords. So the more and more over the next few weeks, we're going to be putting documents into that secure inbox. And what we want to move to is that the secure inbox is not only a place where Discovery is placing information for healthcare practitioners to retrieve information from, but it will also be, as Deanna referred to it earlier on, a place where people can put information into from themselves as practitioners, which don't need to be then password protected. So the whole strategy around registering the HP zone, getting a login, getting a profile, whether you're a practice manager or the healthcare practitioner, that's going to really help us to manage the information more securely, not only in terms of the role that you have, but also just in terms of the fact that we know that it's gone through a secure channel and needs to be accessed securely using a login in terms of your username and your login password. So certainly for the foreseeable future, once emails, well, as emails are still necessary, again, you should encrypt those, but hopefully in time we can find a way to move away from sending information via email into using secure inboxes.
Larry, one question here again regarding sole practitioners around the need to register for pre-auth in terms of section 57 of POPIA.
Okay, I'm not quite sure what they're asking there.
We'll just wait for the team to maybe clarify that and just see if there are any other section 57 of POPIA.
So this is the prior authorization part of the Act. So this doesn't apply to yourselves pre-authing patients for admission to hospital. Okay, so it doesn't relate to that. And we've had guidance within Discovery in terms of section 57. And in essence, what the directive from our compliance team has been is that it doesn't apply to us in terms of pre-authorization, in terms of using information. So this is cases where one wants to use, wants to use information which is typically of a very sensitive nature, and you need to get pre-authorization to share information. Okay, but it doesn't, in terms of the work being done in the medical fraternity, in terms of the healthcare practitioners, this doesn't apply to you. And again, in terms of Discovery, we haven't seen this applying to us in terms of information that we will be working with. So the pre-auth, again, there's the term pre-auth in our world is often around pre-authorizations required for admission to hospital. This is more around the pre-authorization of sharing very sensitive information and getting permission for that. So hopefully I've answered that question, but yeah,
yes,
again, actually nothing to worry about in terms of that.
Thanks. Thanks, Larry. I think there've been lots of questions, but I think we've touched on most of the major themes that have come through. Just again, perhaps to stress to all of you, we are here to help. Please use your consultants, the field force team that help you if you have any more specific questions and that you can't get answers either on the HP zone or other places. Please do lean on us to help you. I think then, as I say, that probably covers most of the major themes. And so again, I think we can close now by 8 o'clock. Just to end by thanking Larry, Diana, but especially I think all of you. We know how busy and under pressure you are, so thank you for making the time to attend. We hope that the session was of value, and please can I ask you to complete the poll that's come up, just to make sure we can keep on improving these sessions. With that, from me and the team, keep safe, and we're here to help in whatever way we can, and have a good evening.